Hello, I'm Dr. Deepika from Saritha Dental Clinics, and today I want to discuss about most frequently asked questions by our patients after a scaling procedure. So the first question that is most frequently asked is, can scaling affect the outermost part of your teeth, that is the enamel? And the answer is no, it cannot, because enamel is the most hardest structure in your body. In fact, it is harder than your bone. So the tip of the scaler itself is much weaker than your enamel. Also, during your scaling, the frequency that is produced by the ultrasonic tips are just enough to break the calculus and the plaque into pieces and get rid of them, but not your enamel. So the procedure is very safe. The second question is, will there be any bleeding during the process of scaling? Yes, this is very common and most of our patients do experience a certain amount of bleeding after the scaling procedure. This usually depends on how much of plaque and calculus deposits are actually present on your teeth surfaces. The more plaque and the more calculus, that means the more infection. That means the inflammatory response is more around your teeth. Thus, this leads to a lot of bleeding. Also, this is one of the reasons that why there is spontaneous bleeding after brushing your teeth. So this bleeding after scaling usually stops after 2 to 3 hours and there is absolutely nothing to be afraid of. So one of the most frequently asked questions is also that why are there gaps between my teeth after scaling? So let me clear this, that these gaps are not actually formed by scaling. Actually, it is impossible for this scalar tip to create any gaps between your teeth, because I have mentioned earlier that this scalar doesn't even affect your tooth surface, that is the enamel. So the plaque or calculus that is continuously being built on your tooth surface is actually the criminal behind this gaps between your teeth. So as this plaque and calculus keeps forming between your teeth, it is impossible for you to notice that there are certain gaps being formed. So as soon as this plaque is removed with the procedure of scaling, you suddenly feel there are more gaps because you feel like there is something missing around your teeth. Also, this is one of the reasons why a lot of you do feel like there is some loosening between your teeth. This loosening is because the wall of the tartar is being removed. So there is nothing more to hold on to your teeth. So this is the reason why you feel your teeth are slightly loose. Also, during the procedure of scaling, the fibers between your gums are usually broken with the scalar tip. So this might also be one of the reasons that why you feel your teeth are slightly moving. But believe me, your gum fibers will actually heal and reattach, and this will help in your teeth becoming much stronger in the future. So another frequently asked question is, why is the sensitivity after teeth scaling? So what happens is, after the buildup of plaque and calculus, the gums recede, due to which the roots of your teeth are actually exposed. So during the process of scaling, the plaque or tartar buildup on the root surface is removed, thereby exposing the root surface to the oral cavity. The root surface is naturally covered by cementum, which is now exposed to the oral fluids, and this can lead to some sensitivity. But however, after the scaling procedure, the gums are then rejuvenated and then they heal, thereby decreasing the sensitivity later on. So I hope I have cleared few of your doubts, and if there are any further doubts, you can always visit us at Saritha Dental Clinic, situated at S. Rao Nagar, KPHP and Malkashgiri. Thank you.